Okay, let's be real for a second.
Mm-hmm.
Talking about vaginal discharge,
Yeah,
it's not exactly like, light dinner conversation.
right.
But it's something that affects so many of us. And we
Definitely.
all have questions about it.
Absolutely.
So today, we're going deep
Okay.
into the world of vaginal
Yeah.
discharge. What's normal, what's not, what it all
I
means
love it.
for our health.
You're so right. There's so much confusion and
Yeah.
shame around this topic,
Yeah.
even though it's completely natural,
Mm-hmm.
for anybody with a vagina.
Totally.
Our goal today is to really just empower you with knowledge.
Yeah.
So you can walk away
Uh-huh.
feeling confident about what's going on.
Yes.
And when you need to see a doctor.
Okay, so let's start with the basics.
Okay.
Before we can even figure out, what's normal, what's not.
Right.
Can you give us a super quick anatomy lesson?
Absolutely. So think of the vagina like a passageway
Okay.
from the cervix at the top
Yeah.
to the vulva. That's the part you see.
Okay.
The walls of the vagina are lined with cells that create this fluid or mucus.
Right.
And that's what we call discharge.
So it's not just random stuff. It's actually created by the body.
Yeah, exactly.
Reason.
Yeah, it's actually a vital part
Oh.
of keeping the vagina healthy.
Okay.
You can think of it like the vagina's own cleaning system.
Okay.
It helps flush out old cells, bacteria, anything that doesn't belong there.
So it's kind of like a self-internal rinse cycle.
Exactly.
That makes a lot more sense.
Yeah.
I used to picture it very differently.
I bet.
But I'm guessing, most things with the body, there's a huge spectrum of normal
Absolutely.
when it comes to discharge.
Totally.
Right.
And that's where understanding your own body
Mm-hmm.
and your own patterns is so important.
Okay.
So normal discharge can change
Okay.
depending on where you are in your cycle,
Mm-hmm.
what kind of birth control you're using.
Yeah.
Even stress levels can affect it.
Wow. Okay, so help us break down those variations. What should we be looking for if we're thinking, is this normal?
Well, generally speaking, normal discharge is usually clear or white.
Okay.
The consistency can be anything from thin and watery
Mm-hmm.
to thick and mucus-like.
Okay.
And for the most part, there shouldn't be a strong odor.
So if we're seeing clear or white discharge, we're good.
Exactly.
No need to freak out.
Yep. It's just your body doing its thing.
Okay, good.
But you might notice that the amount and consistency changes throughout your cycle.
Okay.
Like around ovulation, you might see more discharge.
Okay.
It might be thinner, more slippery, almost like egg whites.
Yeah.
Then in the days leading up to your period,
Uh-huh.
it can get thicker and whiter.
Okay, that's actually super helpful to know. I've noticed those changes, but I never knew why. But I'm guessing those hormonal shifts
Yeah,
from birth control can also, affect things.
absolutely.
Yeah.
Birth control pills, especially with estrogen,
Yeah.
can definitely change the amount and the consistency of your discharge.
Got it.
But again, those changes are often totally normal.
Okay.
It's about understanding your own baseline.
This is making me feel so much less anxious.
Good.
But let's get to the stuff that probably brought most of us here today.
Right.
How do we know when our discharge is not normal?
That's the question.
Right.
And that's where paying attention to these changes is so important.
Okay.
The biggest red flag is any discomfort.
Okay.
Itching, burning, redness, swelling around your vulva,
Right.
or the vaginal opening.
So if it's itchy or burning
Yeah,
or just uncomfortable down there,
exactly.
that's a sign to go get checked out.
For sure.
Okay.
Also, pay attention to the color
Okay.
and the odor.
Yeah.
If it suddenly becomes yellow-green, grayish or foamy,
Right.
or if it develops a strong odor,
Okay.
a fishy odor, a yeasty odor,
Uh-huh.
anything that's just not normal for you,
Yeah.
that's another reason to see your doctor.
Okay, so those are the visual cues and the smell cues.
Right.
What about changes in the amount?
Yeah, that can also be a sign.
Okay.
Especially if you have a big increase.
Mm-hmm.
It could be an infection
Okay.
or some other underlying issue.
Well, what about blood-tinged discharge?
Ooh, yeah, that one can be tricky.
Yeah.
So a little bit of spotting
Uh-huh.
outside of your period can be totally normal,
Okay.
especially if you're on certain types of birth control
Right.
or if you've started a new workout.
Okay.
But if you experience heavier bleeding
Yeah.
or blood-tinged discharge, that's not normal for you.
Right.
Definitely get checked out.
So basically, anytime something feels off,
Yeah,
it's better to just go to the doctor
absolutely.
than to wait.
We're on the side of caution.
Yes.
And I can't stress this enough. Okay?
Avoid self-treating.
Okay.
You might think you're saving time and money,
Mm-hmm.
but you could be making things worse
Right.
or masking a bigger problem.
You mean like trying those home remedies we hear about?
Exactly.
Yeah.
One of the biggest culprits is douching.
Okay, I've heard douching is bad,
Yeah.
but can you explain why?
Sure. So the vagina has its own ecosystem
Okay.
of bacteria.
Mm-hmm.
You can think of it like a rainforest.
Okay.
This balance of good and bad bacteria
Yeah.
is super important for keeping the vagina healthy.
Right.
Douching disrupts that balance
Oh.
by washing away the good bacteria.
Okay.
And then that leaves the vagina vulnerable to infection.
Just like wiping out the rainforest.
Exactly.
And expecting everything to be fine.
Yes.
Which it's not.
It's not.
But if douching is off the table,
Right.
what causes these changes in discharge?
Well, most commonly it's infections.
Infections. Can you give us a rundown of
Yeah.
like the usual suspects? So you've probably heard of yeast infections,
Mm-hmm.
which are caused by an overgrowth of this fungus called Candida.
Okay.
They're incredibly common.
Yeah.
And usually cause itching, burning,
Right.
and a thick white discharge.
Okay.
Then there are bacterial infections,
I.
like bacterial vaginosis,
Mm-hmm.
or BV for short.
Okay.
It's caused by an imbalance of bacteria
Right.
and often leads to a thin, grayish discharge
Okay.
with a fishy odor.
Got it.
And finally, there's trichomoniasis,
Okay.
a sexually transmitted infection
Mm-hmm.
caused by a parasite.
Okay, so infections are a big one.
Right.
What else can throw things off?
Sometimes it's not an infection,
Right.
but a reaction to something,
Oh, okay.
like a forgotten tampon,
Oh, right.
condoms, spermicides,
Mhm.
even certain soaps
Yeah.
can irritate the vagina
Okay.
and cause these changes.
Wow, I never realized how sensitive it is down there.
Yeah, it's delicate.
So we need to be really mindful
Absolutely.
about what we're exposing it to.
For sure.
And one more thing,
Yeah.
hormonal changes during menopause
Yes,
can also lead to changes in discharge.
that's right.
Oh, menopause. It seems like everything changes
It's true.
from
Like,
that time.
menopause brings so many hormonal shifts, and
Ugh.
the vagina is definitely affected.
Okay, so we're going to dive deeper into menopause later.
We are.
But for now, let's focus on those warning signs.
Yeah.
We talked about
Okay.
what to do if we experience them.
All right.
Because even knowing what to look for,
Uh-huh.
that trip to the doctor
Yeah.
can feel nerve-wracking.
It can.
Can you walk us through, like, what to expect
Sure.
at that appointment?
Okay.
What kind of questions are they going to ask us?
Well, your doctor will want to get a full picture
Okay.
of what's going on. So
Uh-huh.
they'll probably ask about your symptoms,
Okay.
when they started, how severe they are,
Mm-hmm.
any other discomforts you're experiencing,
Right.
like pain in your back, your abdomen, your pelvis. They might also ask about your sexual history,
Okay.
like if you have a new partner,
Yeah.
or if you're using any new types of birth control.
So they're trying to, like, piece together
Exactly.
all the potential clues.
They are.
Okay.
And to get the full picture,
Ah.
they'll also want to know about your period,
Okay.
any medications you're taking,
Mm-hmm.
and whether you've used any products recently
Right.
that might be irritating your
Like
vagina.
the douches we talked about.
Yeah, like douching.
Or are there other everyday things we might not even think of?
Yeah, they'll want to know about panty liners,
Right.
feminine hygiene products,
Hmm.
lubricants,
Mm.
even certain types of toilet paper.
Wow.
Anything that comes in contact with the vulva or vagina
Yeah.
could be irritating.
It's more than I would have ever thought of.
Yeah,
But I guess it helps the doctor figure out what's going on.
it does. It really helps them get a clear picture.
Okay.
And then, of course, after they ask you all those questions, they'll do a physical exam.
Which can be a little,
Uncomfortable.
uncomfortable.
Yeah.
But I'm assuming it's really important.
It is. It's essential.
Okay.
They need to see the vulva and vagina.
Yeah.
Look for any irritation, inflammation,
Uh-huh.
discharge that looks abnormal.
Mm-hmm.
They'll also likely do a pelvic exam
Right.
to check your cervix
Yeah.
and other reproductive organs.
Okay, that makes sense.
Yeah.
And what about those lab tests?
Oh, yeah. Lab tests are important, too.
Yeah.
They're crucial for figuring out the cause of your symptoms.
Uh-huh.
So the doctor might take a sample of your discharge
Okay.
and look at it under a microscope. They'll
Right.
be looking for bacteria,
Mm-hmm.
yeast, parasites, things like that.
Okay.
They might also test the pH.
pH, like the acidity level.
Exactly.
What does that tell them?
Well, certain infections,
Yeah.
like bacterial vaginosis,
Mm-hmm.
can actually make the vagina less acidic.
Okay.
So testing the pH can help them rule out or confirm certain infections.
So they're gathering all these clues.
Yes.
Like solve the mystery.
They are.
Of the weird vaginal discharge.
Exactly. Sometimes they can diagnose you right away and start treatment based on your symptoms and the physical exam. But other times they might have to wait for the lab results before they can give you the right treatment.
So sometimes it's an instant diagnosis.
Yeah.
Other times it's a waiting game.
Exactly.
And speaking of treatment, I'm guessing it varies.
It does.
A lot depending on what's causing the problem.
Absolutely.
So I'm hoping you can break it down for us.
Okay.
All the different treatment options.
Let's do it. So treatment really depends on what's causing the issue.
Okay.
It's not a one-size-fits-all.
Right, because like the wrong treatment
could
be useless.
Yeah, or even make things worse.
Oh no.
That's why self-treating can be so risky. You could be treating the wrong thing.
Right.
And the actual problem is getting worse.
And delaying proper treatment can lead to more complications later on.
Absolutely.
So what about preventing these issues in the first place?
Yeah, good question.
Are there things we can do?
Yeah, there are definitely things you can do to help support your vaginal health.
Okay, like what?
Well, remember that the vagina is self-cleaning.
Right.
So douching is a big no-no.
Yeah, we talked about that.
Instead, just clean your vulva with plain warm water.
Okay.
When you shower or bathe.
No like fancy soaps or anything?
No harsh soaps or feminine washes.
Okay, got it.
What about the soap you use for your underwear?
Does that matter?
It can choose something gentle and unscented to wash your underwear.
Okay.
Harsh chemicals and fragrances can irritate.
Right. Makes sense.
It's all about being gentle.
Yeah.
Avoiding things that disrupt the ecosystem.
The rainforest.
Exactly.
Cotton underwear.
Yes. Wearing cotton underwear is great.
Okay.
It's breathable.
Right.
Which helps prevent moisture buildup.
Okay.
And that can reduce your risk of infections.
So ditch the thongs. Embrace the granny panties.
Well, you don't have to go that far.
Okay.
But opting for cotton at least some of the time can be helpful.
Good to know.
And here's a tip.
Okay.
When you're wiping after using the bathroom, always wipe front to back.
That's one of those things I learned as a kid.
Yeah.
But probably forgot as an adult.
It happens.
Why is it so important?
Wiping back to front
Yeah.
can transfer bacteria from the anus to the vagina.
Oh, okay.
And that increases the risk of UTIs.
Right.
It's a simple habit.
Yeah.
But it can make a big difference.
Easy enough to implement.
Exactly.
What else can we do?
Well, if you're sexually active,
Yeah.
using condoms consistently can help.
Okay.
They'll protect you from STIs, some of which can cause abnormal discharge.
So condoms are a win-win.
Right.
Protection against STIs and unintended pregnancy.
Exactly.
But what about when we're not experiencing symptoms?
Yeah.
Do we need to be thinking about this stuff?
That's a great question.
When everything seems fine.
It often gets overlooked.
Yeah.
We tend to only focus on health when something's wrong.
Right.
But preventative care is so important.
So it's like getting your car's oil changed.
Exactly.
You don't wait for the engine to seize up.
Right.
You go in for regular maintenance.
That's a great analogy.
It's regular checkups with the gyno.
Yes.
Even when we're feeling good.
Even when you're feeling great.
Okay.
Those are crucial.
For just general vaginal health?
For vaginal and reproductive health.
What happens at those checkups?
Well, they'll usually do a pelvic exam.
Okay.
To check for abnormalities. They might also do a pap smear.
Right.
To screen for cervical cancer.
Okay.
These screenings are so important.
Yeah.
For catching potential problems early.
Right, when they're easier to treat. So it's all about catching things before they become big problems.
That's the goal.
And those checkups are a good time to ask questions.
Absolutely.
About anything.
Even if they seem small or silly.
Speaking of questions.
Yeah.
We talked about menopause earlier. I'd love to go a little deeper.
Okay.
I know it's a time of huge hormonal shifts.
It is.
But how does it specifically affect vaginal health?
So as estrogen declines during menopause, the vaginal tissues can change. They can become thinner, drier, and less elastic.
And that can lead to discomfort.
It can.
During sex.
Yes, and increase the risk of infections.
So those discharge changes we talked about, they can happen during menopause too.
They absolutely can.
Okay.
A lot of women experience changes in discharge as they transition into menopause.
Okay.
It might become thinner, more watery, or less frequent. Some women experience dryness, which can cause itching and irritation.
So menopause really like throws things off.
It does.
Is there anything we can do?
Yes, thankfully there are things you can do
Okay, good.
to help combat these changes.
Okay.
Over-the-counter moisturizers can help with dryness.
Okay.
And if dryness is making sex painful,
Yeah.
there are lubricants that can help.
Okay.
And if those aren't enough,
Yeah.
your doctor might recommend prescription meds.
To help with moisture and elasticity.
Exactly.
So there are solutions out there.
There are?
We've covered so much today.
We have.
Anatomy of the vagina, the different types of discharge, causes of abnormal discharge, tips for good vaginal health,
Right.
even menopause.
We've debunked myths, normalized these conversations, hopefully given our listeners the knowledge
they need
to feel empowered
and confident
about their vaginal health.
Okay, but before we wrap up this deep dive,
Okay.
I want to leave our listeners with one final thought.
All right.
We've talked a lot about getting help
Yes.
when things go wrong.
Right.
But what about when everything's normal? How often should we be thinking about this stuff?
That's such an important question.
Even when we're not having symptoms.
It all ties back to what we've been talking about.
Okay.
Taking care of your vaginal health is an ongoing process.
Right.
It's about staying informed, being aware of your body's patterns, and not hesitating to reach out if anything seems off.
Even if it seems small.
Even if it's minor.
So knowledge is power.
Absolutely. Yeah, the more you know about your body and what's normal, the better you'll be able to recognize when something's wrong.
Right.
And get help when you need it.
Right. We've been kind of tiptoeing around this all day.
Yeah.
But can we just acknowledge how much shame and stigma
for sure
surround vaginal health?
It's something I see all the time in my practice.
Yeah.
So many people are embarrassed to even talk about it.
With their doctors.
And that silence can be really bad.
It can, yeah.
Because it keeps us from getting the information we need.
Absolutely.
And the care we need.
It prevents people from getting help.
Yeah.
And it just perpetuates all this misinformation.
Yeah.
And these harmful myths.
Like that all vaginal discharge is bad.
Exactly.
Or that you need to douche to be clean.
Those myths are not only untrue,
right,
they can actually be harmful.
I need to normalize these conversations.
Absolutely.
It's not dirty.
It's not.
It's not shameful. It's a natural part of our bodies.
It's like we're finally reclaiming our vaginas.
I love that.
And saying, hey, these are amazing parts of our bodies. Yeah. We deserve to understand them.
Yes.
And take care of them.
This deep dive has been about so much more.
It has.
Than just discharge. It's been about empowering ourselves with knowledge, breaking down taboos, advocating for our own well-being. Couldn't have said it better myself.
Knowledge is power.
It is.
Especially when it comes to our bodies.
Especially when it comes to our bodies.
Well, that's it for this deep dive on vaginal discharge.
I hope everyone learns something.
Yeah, we hope you learned something new.
Feels more confident.
And feel more informed and confident.
About taking care of your body.
About taking care of your amazing body.
Until next time.
Stay curious.
Stay informed.
And stay empowered.